to the webinar. In case of any inconvenience regarding video or audio, please raise your hand or inform us in comment box. If you have any queries or suggestions during the presentation, please type them into the question box in your control panel. I will bring them up during the presentation, and we will also have the time for questions at the end of the session. Please maintain the decorum. Feedback form will be posted at the end of the session in the comment box. Please complete the form to get your e-certificate of this webinar. Thank you all for your kind patience. In this auspicious moment, I would like to express few words about Rehabstore. Rehabstore is one of the largest manufacturing unit, provides rehabilitation products to support many differentially able person. It was first started in 2014, mainly for the empowerment of the children with special care needs. This small initiation has brought us wonderful changes in many lives. It is mainly happened because of the materials and the products which is showcased in our website are completely research based and economical products. Our Rehabstore products are designed and tested by a panel of therapists and rehabilitation engineers. We have added few more end users to our team recently. At present, we have 4,000 happy customers all over India whom they are completely satisfied by our quality products, and we have delivered more rehabilitation products to some of the hospitals, special schools, and SSA centers. Further, we are implementing 300 more customized products to our website soon. Please go through our website for further details. Now, I would like to invite our Audra Special School Principal, Mrs. Subha Ravishankar, to address our presenter. Shubha, ma'am.
Yes, Bindu. Yes. Thank you, Bindu. I'm very happy and I'm so immense pleasure in welcoming our today's presenter, Mrs. Divya from Trichu. Ma'am, thank you, ma'am. Thank you for accepting this invitation and being with us for this auspicious time, ma'am. Thank you so much, ma'am. I welcome you for this session, ma'am.
Hello everyone. Hope I am audible to you.
Ma'am, just a second, ma'am. Indu will give a small introduction about you. 2 minutes.
Sure, go ahead.
Thank you, ma'am. For the past 1 month, every Sunday at 4 o'clock in Zoom app, we are conducting webinar on different topic that is helpful for some of the special care children parents, some of the rehabilitation professionals and therapists to help in improving the performance of differentially able children. This, we are inviting experienced person and rehabilitation professionals from all over the world to share their experience and knowledge with us. Now, without further ado, we will turn the time to our presenter. Dr. Divya is here to present on dental care for children with special needs. Dr. Divya has completed her BDS from Government Dental College, Kozhikode, and she has completed her MDS Oral Medicine and Radiology from Government Dental College, Kozhikode. Currently, she is working as an assistant professor in the Department of Oral Medicine and Radiology at the Government Dental College, Thrissur. Now I hand over the session to our presenter. Ma'am, you can start the session. Thank you, ma'am.
Thank you, Indu. Hello everyone. I welcome you all to this session. I'm here to given the topic of discussing the dental care needs for the special children. I hope I'm audible to everyone and it's clear. And I thank for this opportunity, and I'm very privileged to have this opportunity. And especially, I thank Mrs. Shubha Ravishankar and also Mr. Ravishankar, who's all in all behind this Adhura Specialty School for the special children. And they are, I've come to know that they're doing so much of great efforts to help these children with special needs. And they are one of the pioneers, I think, in India to start this rehab store, which helps in addressing the needs of the special children. And also, uh, I was happy to know that they even have a software to help these children, and even those clients who are helping them. And also, it is a great help for the parents who need a special team behind them to support the special children. So I am just giving you a glimpse of what kind of dental findings which we can see in this kind of children, or the special needs, dental needs of them, and how we can address it as a dentist, or as a pediatric dentist. What can be done to help them, in what all things we can prevent this dental oral health problems which occur to them. So these are the things which we are going to discuss today. So feel free to ask any queries to me, and to my knowledge, I will help you out. And I'm very thankful to everyone here in the Rehab Store and the whole support team for giving me this opportunity to talk here. So with that words, I'm going to start the session. Can I start the screen sharing, Indu?
Yes, ma'am.
Okay, thank you. Okay, so let's start with the dental care for the children with special needs. So to we introduce about the special healthcare needs for these children, we know that the emphasis should be placed on the primary disabling condition. And as we all know, the disabling condition can vary from just a social inhibition of the children to interact with others as the others do. And it might be some kind of emotional or a psychological problem, and can even range to some serious issues like hemiplegia, paraplegia, and even some kind of impairment like hearing or speech impairment, and that can even be a kind of cerebral palsy, a more worsening condition, and it could be due to some kind of syndromes like Down syndrome. So basically, the special healthcare needs differ in all these conditions. And as we all know, this oral health and function are essential to the overall health of a patient. So let us come to this in detail, what a dentist does. So in this case, a dentist can deliver what we speak about as special care dentistry. So it's a kind of dentistry wherein there is a delivery of dental care tailored to the individual needs of the patients who have this kind of disabling conditions, maybe mental or psychological limitations, and that would require the approaches which are beyond the routine ones practiced in dentistry. So that is the basic understanding which we need to have. So this is not a routine approach that we go with the patient, and they need a special care which has to be extended to, and also it has to be tailored to their individual needs, and also it should address the parents' concerns. So according to that, we can just deal with that in three terms. We can say that basically these children might be suffering from an impairment, might be due to some lacking part of body or limbs or an out mechanism of the body, and might be there might be some disablement in them because of loss or reduction in any functional ability, or even there could be a handicap. Maybe there is a disadvantage or a restriction which is caused by disability. So these are things which a person who's interacting with the special healthcare children, special need, should be cautious of or should be aware of actually. And then you have to identify the dental problems in these children. So what are the actual problems they are suffering from, and then you identify the dental problems which is pertaining to them. So it might not be the same in all of them, it will be differing, and there are a few conditions which are seen in all the children, but still there are certain differences. So let us go through them in detail. So these are the basic conditions or the common conditions that occur in the children with special healthcare needs. So mostly the children who can take care of themselves, or who are able to do the self care, uh, are very different from the other syndromic or children's. So according to that, I would like to tell that the syndromic persons would have some kind of different presentations in the oral cavity, like you say, a big teeth, which we call as macrodontia, or might be having a small teeth like microdontia, and there might be some few teeth which are more in number, that we call as hyperdontia, and there might be less in number of teeth, which we call as hypodontia, and even there might be more number of missing teeth, we can call it as oligodontia. And sometimes certain syndrome like ectodermal dysplasia, wherein they have problems with hair or nails along with the teeth, we can call it as anodontia, which is a little bit a more serious condition. And then they might also suffer from some conditions like where they were not able to chew the food properly, like they will have some crowding of teeth and all. So we can see some malalignment of teeth like this. And then even they cannot bite with the help of their teeth, I mean front teeth especially, we call it as open bite. And sometimes the bite will be so deepened so that they will get more of accumulation of this plaque and all, or the food debris will be getting accumulated. For that we call it as a deep bite and all. And in certain cases, especially not pertaining to the teeth, it could be even related to their jaws. Actually, there could be an increase in the jaw size, there could be a decrease in the jaw size. We can call it as macrognathia, which is increase in the jaw size. Either it could be the upper jaw or it could be the lower jaw, and it could be a decrease in the jaw size. So it called as micrognathia. Even again, it affects both the upper or the lower jaw. So the first picture, the left side one depicts a child with a macrognathia, and the second one, the lower side one, shows a child with a decreased jaw size or micrognathia. And then sometimes we can see that our children might be suffering from some kind of habits like a mouth breathing habit. It's not that they develop as a part of habit, it could be secondary to their impairment or the suffering actually. So what are the features which we can see in those kind of children who's having a habit of mouth breathing? So they might be having this kind of flattened nose, they might be having adenoid facies, that is what we call, that is a long face with a short upper lip, and they will have a receding chin or a micrognathic chin. And they will have an exposure of like a posture, special posture, like a forward head posture, which is not common with the normal children. And even the normal children who doesn't have any kind of behavior like dyslexic behavior and all, even those people can have this kind of appearances. I'm sorry. Okay, and the picture in the latter picture, you can see the lower side, there is a tongue thrusting habit because of this open bite, which we discussed, wherein the children are unable to chew the food with their front teeth because of the malalignment. They will have the positioning of the tongue, which is done on the lower teeth. So that's kind of a problem, dental anomaly, and we call it as tongue thrust. And then one more problem we see is this lip trap, wherein the children tend to trap their lips because of this malalignment. And also the children might suffer from tongue tie. And these are all basically the conditions which can lead to a speech impairment or even a hearing impairment. And these are very basic things which we can correct even with the help of a dental surgeon or even a plastic surgeon or a pediatric surgeon. And these things are the very basic things which can be addressed easily so that our child can lead a normal life. And one more thing as in dental is that they will have this habit of clenching their teeth. Maybe they are more prone for anger. The tolerance level might be less in certain children who suffer from athetosis, and also maybe because of that they will have this clenching habit, and the attrition of the teeth are more common in them. And then you have drooling of saliva. Maybe certain patients who are suffering from Down syndrome and all, they will have this saliva drooling from their oral cavity, which is even unknown to them. So that also you can help. So these are the basic things which we see in the children, special dental care needs. And again, these are not common, but still we see certain children with cleft lip and palate in the mothers who have undergone some kind of drug therapy, or it might be even genetically transmitted. So this again can be repaired even in the small ages. And this is one more common and very common dental condition which we see is the deposition of debris, or you can say that we call it as plaque actually. And that plaque, when it is accumulated for a long time, it converts and it gets calcified to form a thing called as calculus. You can see that in the lower picture. You can see some cement like substance, which is gritty like substance, which is sticking to the teeth, and it is very difficult to clean. You can't make it, just a toothbrush cannot clean this substance, so you would require a professional help for this. And also this could lead to a poor gingival condition, or you can say that there are poor health of the gums. Gingiva means gums. So it could lead to a poor health of the gums, and that could lead to the inflammation or swelling of the gums. That is the picture, the first one, which is depicted above. And that can lead to swelling, and also you can see that bleeding can be there from the gums, and also it will be seen as a reddish color. Even we cannot tolerate our children seeing or suffering with such conditions, and these conditions can be very well addressed in the beginning. Whereas if it has become like a gritty substance like calculus, it would definitely require a professional help uh, to clean it. And then the most common other dental problem which everyone would be dealing with will be the decayed teeth, or a hole in the teeth, as we the layman's term it. So this is basically the anterior or the front teeth. When it is getting carious, it will look like something like this in the top picture. And if it's the posterior teeth or the lower back teeth, which has been shown in the last picture. And the problem with this is initially they will have only some kind of food lodging, or even the sensitivity to eat some kind of sweet food, or maybe a hot or cold food. They would be intolerant to that, and they will have kind of some kind of restlessness or some expressions to tell you the difficulty, so that the parents should address it at the initial stages and doesn't become worsened. So once it becomes worsened, it will attract some other expensive measures to address them, like say we can do a root canal treatment, we can rehabilitate the tooth, we tend to conserve the tooth in various ways possible. So that will all require professional help, and also even a more of time and energy and expenditure. So that could be even prevented if you can address the complaint at an earlier stage. If the patient complains of a sensitivity, or if there is a complaint of a restlessness shown by the child while having a hot food or a cold food or even a sweet food, and if they are having a problem with chewing food and all, at least we can address it in the initial stage, and we can prevent them in developing in certain conditions like even caries. So these were the general dental problems which our children, or the children with the specially able children, are going through. So let us come to the things which we have to know while managing them. How to manage them? What are the general principles we have to know? So, and as we all know, as we already talked about, prevention is always better than cure. So whatever is the dental care, it should start from our home, or even the caretaker or caregiver, and even that as parents, along with the special whoever is dealing with the special child. Maybe it's kind of a team, they are behind them, like caregivers, or even it might be a special school. So all these are can do a very big part uh, in preventing the dental diseases or oral health conditions, it's going to trouble them later. So this is a big thing which we have to, this should be our motto, to make their life better, or how to rather than rehabilitating them once they suffer, it would be better to prevent these conditions from occurring. So let us see what are the basic methods of home dental care which we can exercise. Even the home dental care will include the school dental health programs also, in which the child is enrolled to. Maybe they are attended personally at their home by some caretaker, or maybe a therapist, or it could even by attending a special school like Atura. So it all begins with the basic care. So let us know what are the small things which we can take care of while doing, or pertaining to the special care. So first we have to get it educated, get us educated by ourselves, for so that you have to participate in the webinars so much conducted over here and there, and also so many pamphlets are being provided, and even so many classes have been conducted, conferences are conducted, so that the parents or the guardians or the caregivers and those who are involved in this kind of activities in special school and all, they can get the education by themselves. So what all things can be done from the school, or what kind of dental health can be, how can what can I do in giving a proper dental care for my child. So that kind of education should start from ourselves. And then we should get this reinforced through the mass media, because we know we have got so many interfaces like social and internet interfaces, wherein we can update ourselves with the latest methods and all. So that is very easy to gain knowledge. And then the basic thing of dental care will start from a toothbrushing technique. That means you can use a horizontal scrub method, horizontal scrub method. Okay, and for that you can use a gentle horizontal strokes on the cheek, tongue, and biting surface of all teeth and gums. And for that, the basic thing will be to start with a soft multi-tufted nylon brush. That's what we use commonly in our home. So we all know, we are all well aware of that kind of soft multi-tufted nylon brush. And the horizontal scrub method is nothing. It's just not just a name which is tagged in. That's all. It's just a linear way wherein you brush in a that's like a drawing a line. That's all. How you brush it forth, bringing it back and forth. That's all. That is a horizontal scrub method, which we exercise during the brushing. So that is the first thing which we can teach our children. It's an easy method of toothbrushing. I'm sorry, there is some technical issue. Okay. Okay, now let's start with our babies. So what all things we can do to ensure a healthy teeth for our babies? So let us know that this is very important, because we go wrong here. Like before even the teeth erupts, we should clean the baby's mouth and gums with at least a soft cloth, or even gauze which we apply on the wounds and all. And sometimes even an infant toothbrush is also available, and this can be easily done while during their bath time. The easy method, and it's very effective to clean the baby's gums with some kind of ring design you make on your fingers with the help of this cloth, and then you do it. Make sure that the cloth is sterile. That is the only thing. We have to make it is clean from any kind of germs and all. The surface should be clean. Okay. And once the teeth erupts, what we can do? Once the teeth erupts, clean the child's teeth at least twice a day. Either you can use a toothbrush designed for small children, or else we can even get some kind of fingered brushes, which we can insert our fingers, and then we can put it in the mouth and then brush it. So actually, these are the things where we go wrong. Not the children with the special needs, even for the normal parents who are having blessed with the normal children also. I don't think most of them do exercise this kind of care, dental care to them. So this could lead to problems later. Okay. So these are the things which we have to remember how to exercise. So this starts from the babies itself, the dental care. And then you have to take the baby to see a pediatric dentist by the baby's first birthday. The earlier the visit, the better it would be. Why I'm talking to you like that is, mostly we know that we might not have taken our babies, and even we might not have needed such a visit, but that is just to acquaint them to a specialty like that, or a hospital scenario like that. They might have been taken to a hospital wherein they might be getting some kind of injections, some kind of vaccinations, and they are just scary of that part, wearing that kind of white coat with that mask and all. So these children get so much scared, even the normal ones. So just think about uh, special child who's having a kind of a little bit of mental retardation. Maybe he might get more scarier after seeing all this kind of stuff. So this is the thing wherein we can just familiarize by bringing them, so that we don't have to take some kind of any efforts, or do some actual oral work on them, just to get acquainted to the dentist, just to talk with them, just to show that is somebody that you might be knowing, or like that. You can just get them acquainted to the person you're going to visit. So the first thing would be, you should select a dentist or a pediatric dentist, whoever it is, who is going to give a special need. Who you are going to approach when you need a special need. So that is there, and then get them acquainted with that person. So that is the best thing which we can give them before their first birthday. And then we can, in the house itself, what kind of things we are getting to make their life and our life easier. We have got so many specialty toothbrushes, and I think most of them, we know some of the toothbrushes which are available through internet and stuff. And I think it is very important that there are so many gadgets or dental products which are specially tailored for this use of children with special needs. So for that, you have to know what all things are and how they work, and also that you can make use of them. And some are expensive, I agree with that, but still certain things which we can even make use of for our children, so that we give them a better life, and we can also give them some kind of time, and we don't have to force them into something which we don't, which they and even we don't like. So that are the things we have to take care. For that, you have to make our knowledge updated. For that, I've just put a brief idea on the kind of brushes which are available in the internet, like College Curve. There is Surround, a toothbrush which is Surround, wherein you have 3 bristle pads to efficiently clean all the surfaces, and you have some kind of Dex toothbrush. And also, again, it reaches all the surface of teeth, and includes, it will also include a tongue cleaner. And there is something called as a toothbrush with suction. So this is the thing which helps in a child with a spasticity or a cerebral palsy and all, wherein you cannot, wherein they are unable to spit the spit and rinse their oral cavity. So in that case, it is connected directly to a standard suction tubing. Then that suction will take out all the saliva and all those rinse the debris from their oral cavity, so that they don't have to spit on their own. And there are certain power toothbrushes in the sense they operate on electric toothbrushes, and they've got a wide variety of features, and even they are a little bit expensive, but still those who can afford them, they can very well go for a powered toothbrush, because it enables to maintain a proper oral hygiene. So I'll brief through the kind of brushes. Like this is one of the brushes I talked about, the Surround, which cleans both the thing. Like we know that the children with special healthcare needs will not have time for the, they won't give you time for exerting a cautious brushing technique and all. So in that case, you will have to just give a proper proper stroke, so that you can finish it in time. So that kind of proper stroke will not be available. Maybe if a normal child brushes the teeth, and if you ask them to brush for some, say, 3 to 5 minutes or so they will comply with you. And this might not be possible with a child with a special healthcare need. For in that case, we have to use such kind of brushes, wherein even with a single stroke, you're going to clean all the surface of it's included. All the surfaces are being cleaned in at least a thorough stroke. So that is what is the purpose of modifying these brushes. And this is one more brush which we see, that is called as the powered toothbrush. And this powered toothbrush we can use, and this will help. It has got so many activities, like it helps rinsing the teeth as well as cleaning the interdental areas, which we call like the in between teeth areas. So there are small pocket like areas wherein it's difficult to go with the help of a normal brush, so that will be getting clean with this kind of electric toothbrushes. And there are certain toothbrushes wherein there is no need of using toothpaste only. It helps with the it works with the help of ions, or so it's kind of charged electrons which are generate charged electrons, which helps cleaning the debris away from the tooth, so that we don't have the tension that they don't swallow the toothpaste inside. Maybe if they are so small, and if you are using some kind of fluoridated toothpaste or fluorine included toothpaste, that means it's a compound which is usually given in the toothpaste to prevent the caries, occurrence of caries. I'll come to it later. So that is a compound, and then we know that's kind of chemical, or it's kind of a mineral, and we don't want them to swallow it. So it's kind of a concern among parents then whether we can use it or not and all. So in that case, we can even go for these kind of brushes wherein you don't have to use any kind of toothpaste. You can just go in and use this. And there are even certain toothbrushes, smart toothbrushes. Like this is the era of smartphones, and we know that how much our Android smartphones can do, and it's like a magic. Even with the help of a mobile phone, you can manage the areas where areas or arches where you need special attention, or any area wherein the tooth is crowded or it is not easy to clean. That area you can select, and you can apply more strokes in that area with the help of that and all. But it's again not controlled by the child. It can be controlled by the parent with the help of this powered toothbrush. And then you have got the self-balancing toothbrushes, and you never have to worry that it will fall down onto the bathroom ground and all, because when it's not easy for them to place it on a proper top and all, because of their motor problems. So they cannot coordinate the activity, so it doesn't help them in that way. And also there is a tooth guardian system, and again you can see that there's a high-tech mounted mirror with a hidden screen, so that you can just see the areas and then brush it. So it doesn't help. I'm not talking that it's going to help the child. It's more of a help to the parent, so that they can even see that areas wherein they are giving the strokes, and also they can appreciate whether there's any caries and all which is going through whenever they're giving applying this kind of brushing strokes to the teeth. So this is again a help. And then we have to understand, whenever we exercise care to this kind of children, we have to know that there are three different kinds. According to Bensberg, we know that there are self-care group, a partial care group, and a total care group. According to this, the how you exercise the dental care will also differ, and the kind of help they need will also differ. So let us see what we know about self-care group. So I know you all are very much familiar with this more than me, but still I'm just going through it. Like, self-care group are the ones who are easiest to work with, as we all know, and they will have some kind of rheumatoid arthritis, or might be they might be having some chronic damage to the joint and all. Might be some small problems, and for them, this a modification of the brush handle, or maybe for the brush bezel, or a contrangling of the brush head might be needed. So that is the one which we need. That's all. And they may even have the ability to floss, or dental floss, what we call, are the kind of lean, what you say, like rope like things. I can show you that. And this dental floss, with that they can clean the interproximal areas, or the interdental areas, what I again call the areas between the teeth, and then they can clean with themselves. So they don't need much help. That is why they are called a self-care group. In that cases, they will have that easier way of managing themselves, so that they will not get caries, or they will not get any gum disease and all. Whereas the other group, which is partial care group, and they are moderately and often retarded group, so they need close supervision, and even you have to directly assist them, and even they might be able to brush only the front teeth. And in that case, we have to exercise patience, and also you have to distract them, and then you should tell, like you should give them some kind of positive reinforcement, say them that it's kind of a activity wherein your tooth will sparkle, or it will look like a star and all, and it keeps your teeth from hurting, and will keep the germs away. And that are the kind of behavioring techniques which you can use while you exercise for this partial care group. And you should not expect them to rapidly learn anything, and you can just make up some kind of fancy calendar, and even you can put a star if they exercise the care on their own. If they start brushing on their own, you can put a star and tell them, wow, you've done a great job today. So that would give a boost to them, a moral boost to them. So that is how we can get them brushing on their own, and this can be practiced in routine. And once after each step, you can ask them to repeat the task many times until it is mastered, and then only you move to the next step. We have to exercise so much of patience, and this group are the most easy to handle with, rather than that they will comply with you easily. And you should break the task into small easy steps, so they can accomplish any task. Even toothbrushing is to be considered a task which requires your motor skills. So you should hold the toothbrush with help, and then they should put the brush in mouth with help, then make the brushing strokes in the mouth help with help. This should be first exercised with help, and then ask them to just make the brushing strokes by self, and then brush the teeth from beginning to completion by self. On just demonstrate them and make them do that, like tell, show, do technique. That's what we call them, no? Tell, show, do technique. You tell them first, then you show them how it is being done. Maybe it could be a just a colored picture, it could be even a video, it could be even something, a demonstration by the mother itself, or maybe some caregiver who can demonstrate them. Maybe they are more, who they are more having rapport with, maybe even a dentist. So that way it can be done. They can break the task, and it can be accomplished in small easy steps. And the most common technique which we make, not in babies it would be like horizontal scrub method, which I told you, just to move the brush back and forth. That is enough. Whereas in case of children, who are having some kind of teeth and all, who have started erupted teeth, so for them you can do this kind of round and round technique. That is what we call as phones technique. For that, it requires a little bit of motor coordination. For that, you have to ask the child first to stretch his or her arm, so that at least they can make it, hold it parallel to the floor. The uh, holding it parallel to the floor is very proper. That is the first thing to be done. And then they are asked to draw big circles, so using the whole arm in the air. And then they can directly reduce the diameter of the circles into smaller ones. And in front of the mouth itself, they can demonstrate it later on. And now, once the child is ready to make the circles, you can hand over them the toothbrush, and then ask them to make circles with the help of the toothbrush. And then you can ask them to do in front of the teeth and gums. And gradually you can introduce into the oral cavity or the mouth, and then ask them to exercise this. So that is how it can be done easily. Now I can show you a video wherein this phones technique is used. I hope this video is visible.
No, ma'am.
It's not seen. Okay. I hope it's visible now.
Yes, ma'am.
Okay, so that's a simple way to do it, just by going round and round. Okay. Is that PowerPoint visible now?
Yes, ma'am, it is visible.
It's visible? Okay. I hope at least now we can know that how the smaller and the bigger circles are made in the oral cavity, and how we can do this brushing easily in our child. Okay, then and then the last one would be the total care group. Here we know that they are profoundly retarded, or they might be even confined to their wheelchairs, or might be bedridden even. And we know that they need much individual instruction and help. So here comes the role of this kind of powered toothbrushes, that ionic toothbrushes, wherein we don't need dentifrice or toothpaste. So they may not be able to use a dentifrice or rinse. So in that case, what we can do is, and even they might not be able to spit whatever there in the oral cavity. For them, we can do the brushes wherein the suction is being fitted into it, so that it sucks whatever there in the oral cavity, saliva or whatever water you have poured in to help them brushing. So that will be sucked in, and then it will be removed from the oral cavity automatically. And these are the children who are more difficult to manage. So we have to exercise caution, as well as we have to have more patience while managing. Now, one more thing is that one more easier way or to understand this concept is that this kind of powered toothbrush has got a more good thing to do is they are going to desensitize your child. So that vibration and noise which is attached to that brush will help in desensitization. And even that design and color of the toothbrushes are even inspirational for the child, and it gives them motivation to do or exercise this dental care by themselves. So even if they won't be scared that you are introducing something to the mouth, they'll get scared, or they will be getting baffled what you're going to do with them. So that kind of thing you can prevent with the help of this kind of desensitization, using a colorful toothbrush and even the different toothbrush designs and all. Now, how can we position them for the toothbrushing technique? So this is one kind of skilled activity actually. As for a normal child, it's we know that's a standing posture which we exercise. But sometimes it might not be. We should not be forcing them to do it in a such a way that it should be done in a particular manner. That is what we expect from a child. So that not should not be done. You can ask them to be on their own, like to be on their in their comfort zone. Maybe it might be in the sofa. Let them do it in the sofa. Let them start exercising the care by themselves, however they feel it should be done. And then you can make them place them sit on the lap, or even you can make them sit on a floor. And maybe even from the wheelchair itself you can exercise this. And for bedridden patients also, you can just tilt their head and exercise the care with a help of maybe two or more caregivers. They can do it. So just don't force them into a position wherein you can exercise the dental care, so that it becomes a tedious procedure for them to follow, so that they will not comply with that activity after that. So how can you approach to such kind of treatment? That is what I have already mentioned. Like, you can just tell them, you can show them, and then you can make them do. It's just going in gradual. You can't introduce everything at once. You should tell them, then show them, then do them. And you have to maintain a friendly manner. You have to approach them in a friendly manner, as well as in certain cases you have to maintain an authority. It's not like we do to our normal child itself. So that is how it should be done. And then even you can use some hand signal, maybe if they are forgetting some kind of motion or something which they forget about, then you can use kind of hand signals. And even you can ask them to hold various instruments, and ask them, then they can hold the toothbrush. Maybe you cannot expect them to hold, as toothbrush is so thin, or actually it is thin when you compare to some bigger things like vessels, utensils and all. So you cannot expect them to hold on to a toothbrush as in one fine morning. So for that, you can ask them to increase their motor coordination with the help of other instruments, and then you can gradually give the toothbrushes and ask them to do it. And also you can give some kind of a reinforcement. You can do kind of certain rewards, and it doesn't apply to everyone, but even in certain children it works. You can just reward them with maybe a clap, or maybe a pat on their back, or maybe a high five will do sometimes. If it is a small child and all, they will feel happy to do this activity again and again. So certain rewards can even help them, but it might be ineffective for someone. That works, that sure is it's there, but still we have to work on it, what next can be done. And sometimes they might not need any treatment. No treatment might be the best treatment at times. You should not force them actually. If they're not doing it, maybe after a repeated instructions, even after you've tried maybe for 1 week, 2 weeks, or even 3 weeks, if you're not complying with it, just leave it. Maybe the one fine morning the child will start doing it on their own, or even they might ask or hint to you that they need the kind of they need the teeth to be brushed, or they might ask for the toothbrush, or some kind of positive outlook. You will get it if we have exercised this kind of patience in our child. And what are the other things which we can take care of? Now I've talked a lot about this toothbrushing and all. Now what all other things which we have to see? Once if it's a small baby, what's a common thing we do is to place them to sleep. We breastfeed them, and also we should sometimes bottle feed them with milk or some kind of sugar foods and all. Maybe some beverages like sweetened things, sweetened not beverages, sweetened some kind of foods. But that is actually not needed. You can use nothing but water. If you have fed the child properly, then if at all they need something to be supplemented with, you can use just water, plain water. And also after each and every breastfeeding session, or whatever feed the patient is the child is having, after that clean the mouth and gums and tongue with the help of that cloth which I had already talked about, sterile cloth which has been wrapped around the fingers. You can just clean their mouth, their gums, and always remember to clean their tongue. And if it is not done, a child can go through some problems like what has been depicted in the picture. The child can have some kind of candidal infection. That's what we call. It's kind of fungal infection in the oral cavity, which are seen as white areas, which gets, you can remove it easily, but sometimes it can lead to bleeding and all, and it can even lead to burning sensation into the mouth and all. So these are the things which can occur, which we don't thoroughly clean them. And what are the other activities we should discourage? And certain child, even the normal ones, do have this habit of sucking thumb, right? So the sucking thumb activity should be depromoted. It's not a good thing pertaining to their development of the jaws and also about the teeth. So that will hinder this jaw movements and also the development of the teeth. So that has to be discouraged. So for what can be done, then the next thing would be to substitute it with a pacifier. Instead of thumb, some people will encourage using pacifiers, but still use of pacifier is fine if the child cannot be withdrawn from a habit. But still the pacifiers which are depend in some kind of sweetened foods or drinks, that is not encourageable. So at least make sure that the pacifier is just a normal one without any kind of honey or any grape juice or anything which has not been dipped into any kind of sweetened juices. It should be plain. Or else it is better that don't use any kind of pacifier, and even if you can I mean, make them come out of this kind of thumb sucking habit, it would be very great. Or else it could lead to some kind of malalignment of tooth, as shown in the picture, some kind of tooth, I mean, tongue positioning anomalies, which can lead to the speech impairment later. And also, it could lead to their altered psychology also sometimes, because maybe the child might get a traumatic mentality later on because of their speech problems and all. So that might lead to trauma in itself, and that could lead to behavioral or psychological problems later. So these are the small details which we can consider while the child grows up. Now, what are the other measures which we can do? Sometimes even certain parents ask out of concern, if we are not able to brush them, it's not at all possible and all, then what are the other kind of measures which we can do to give them a kind of oral health care? So for that, there are so many products which are available nowadays. You can go for a mouth rinse. Normally we use Hexidin mouth rinse. You might have seen this green colored or blue colored liquid which has been used, or that too can be exercised with caution, not for those who cannot spit it, for those children who can comply with your instruction and who can spit it but are afraid of using toothbrushes, can very well be managed with the help of this Hexidin mouth rinse. And even there are certain anti-cavity mouth rinses available like Proflow and all. That's just examples I'm giving. So these mouth rinses can also be used. And there is plaque removing mouth rinses you get in order to remove the plaque or the debris from the oral cavity. As I already showed you, the kind of gum disease which developed due to the debris. So for that, to prevent that, you can use this plaques, anti-plaques mouth rinse. And in order to prevent the occurrence of tooth decay in these children, tooth decay in children can be prevented with the help of toothpaste, certain toothpaste, like what you say, like toothpaste containing fluoride. Fluoride is a compound which can be used in the toothpaste to prevent the occurrence of caries. What does it do to our teeth? It does the action of fluoride is that it increases the strength of our enamel, increases the strength of the enamel, which is the outer coating of the teeth, so that the dental teeth, I mean dental parts, are not attacked by any kind of microorganisms or acids which are created by them, so that a hole is going to develop. So that hole is called as dental caries, nothing else. So this dental caries can be prevented by using this kind of fluoride containing toothpaste. One example is that Kidodent, and there are certain kind of tooth mousse which are more friendly to them. And GC tooth mousse is an example of that. It contains even calcium and phosphorus ions. We know that the outer coating of the enamel or the dental thing is made up of calcium. That is just common knowledge. Everyone knows something occurs to the teeth, they will come and ask, Madam, maybe my child is deficient in calcium. That's why he's having got this kind of white areas or black and yellow areas on his teeth and all. So that's a common knowledge. We all know that. So it's good to know that. Along with that, we can give them, supplement them with the help of this calcium and phosphate minerals in the form of toothpaste, so that helps them to inhibit the formation of caries. It prevents the formation of increased holes. That's all. It doesn't treat the actually formed holes. Once the holes are already formed, you cannot treat them or you cannot cure them. You can just restore them. That's all. We can do a conservative procedure. We can fill that caries. But you can prevent them with the help of this kind of compounds like fluoride. You can give the calcium, phosphate, and all. So these are the things which are available in the market. Sometimes even I told you, if there is just a beginning of the decay, there's a small discoloration on the tooth, or maybe there is a brown stain which you can see in the teeth of the child. The teeth might hurt while taking some kind of cold or hot or sweet food. So the child might complain or might be restless or may show some kind of facial signs in order to address his trouble. So for that purpose, you can use some desensitizing toothpaste are there nowadays. I mean, you might have heard so many advertisements and all. One of them is Thermosil, which is normally used in children. Thermosil toothpaste is there. You can put the Thermosil toothpaste. You can use the Thermosil toothpaste as a normal toothpaste. So in that case, even if it is a small pit or a fissure where the tooth find the problem, there's a problem for the child. So that will get addressed automatically. You don't have to restore it. Maybe after some time it will get calcified on its own with the help of the dietary supplements and all, and then it's very fine. You don't have to visit the dentist only for that purpose. So these are all the preventive aids which we are talking about for now. And what are the other preventive methods which we can do? We have already talked about the toothbrushing technique, right? And I've already discussed the horizontal way by which the tooth can be brushed, and even the circular way phones technique. We have seen the video how to brush the teeth and all, what kind of toothbrushes are available, and even spare the toothbrushes if you are unable to use the toothbrushes, and if the child is scared of toothbrush, even they can go for other interdental cleaning aids. They might not be able to use them. I am repeating it again and again. They might not be able to use them on their own. Obviously, it requires a lot of coordination. Even for the normal people, find it difficult to use this kind of interdental cleaning aids. But trust me, it helps you a lot. It helps a lot of parents, even children with special healthcare needs, because we don't have to visit our dentist often for this purpose, and also it is so troublesome, right? So for that need, you can use this kind of interdental cleaning aids. So these are the pictures of certain interdental cleaning aids which are available in the market. The first one will be interdental brush, which is being shown, and the second one and the third one, topmost second one, you can see some kind of handle with a linear thing, and that is called as actually a dental floss. Dental floss, which is already fixed to a handle, whereas the third one, wherein you can see the fingers which are using, tied with a small rope like thing. It is nothing, it's a thread which helps you cleaning the interdental areas. It's a thread. And the last one will be again a interdental toothbrush. So what are these actually? You don't have to you don't require this in a child who's having a normal aligned teeth, or a teeth wherein you don't see so much of gaps and all. Some teeth in some children, I have already, as already discussed, they will have microdontic teeth. Microdontic teeth means the small teeth. So there will be so lots and lots of gaps. And for some children, they might have lost their teeth earlier, and for some children they might not have erupted properly. So in that cases, there might occur so many gaps in between and all. So that will be very difficult to be brushed with just a toothbrush. You cannot just maintain the oral hygiene. In these cases, this will help the cleaning activity better cleaning activity. It might be some one or two areas which might need special precaution, or special care which you have to exercise in cleaning. For that areas, you can definitely use it if possible. So then we have to understand this process of dental decay. In that case also, we can prevent the occurrence of this decay. How we can prevent it? So obviously, as we all know, eating sugary foods can lead to decay. Even intake of sugary drinks, wherein the sugar can lead to dental decay. But that is just not the thing. Just eating a chocolate doesn't make the teeth caries, or doesn't make the teeth decay. The sugary food, if consumed like sticky ones, if like say a caramel chocolate which sticks to their teeth and the particle stays in, that is the one which is going to cause a localized area of acid formation, and then their enamel will get decomposed because of the acid, and then decay will occur. So just because the child ate a candy, it's not going to get decayed. So just make sure that once if they have eaten a candy, make sure that there are no particles stuck to their teeth surfaces, and also just make them consume some water or something, so that especially plain water, so that it is getting rinsed away from the oral cavity. That would be fine. And just giving a sugary drink, for say like we give them some kind of health boosters, maybe say Horlicks or Complan, that is not the matter. It's not the sugary drink, I mean the sugary drink, even if it is any kind of lemon juice or anything, any juice, fruit juices, they can, if they are frequently sipping it. For example, if a child is sitting for a long hours, or in some kind of OPD to visit a dentist, outpatient department to visit a dentist, or maybe to visit some other doctor, and if you want to distract him from other activities and all, if you give him a bottle drink, say Mirinda or Coca-Cola, and you give them to just make them sit over there, what is he going through? He's going to sip it continuously for long hours, maybe 1 or 2 hours, and whatever time is going to take. That is the one thing which is going to do harm. So it is not just giving a glass of drink which is going to affect them. It's just the frequent sipping or the frequent snacking is going to affect them much. And also certain children will have this problem of acid reflux or GERD, which can be associated with the physical condition they are going through. That we have to identify. If they have got an acid reflux, which is coming from their stomach, that acid reflux. So because of this acidic product from the stomach, which is reaching their mouth, that can lead to the enamel degradation. And again, the hole can be formed. And sometimes in certain children like Down syndrome, Apert syndrome and all, what happens, the enamel itself is deformed. So that is again a hereditary condition. So enamel is not a normal one. So here, what is going to do, even if a small amount of sugary food which is staying there, it is going to cause degradation of the enamel. It's not going to grow back into normal. So again, the cavity can develop easily in them. So in that case, you have to exercise special care. You have to exercise special care in order to prevent frequent snacking, and make sure whatever snacking they do, it should be healthy. That's all. And in order to prevent dry mouth, that is very important. Preventing a dry mouth, you have to frequently give them some kind of water, not any sweetened substitute, so that the dry mouth can be easier way for the microorganisms to grow, because saliva itself has got some kind of enzymes which inhibit the growth of bacteria, microorganisms and all, germs and all. So without a decrease in saliva can have an altered effect on this enamel surfaces. So with the help of salivary substitutes are there nowadays available in the market, salivary substitutes, you can go for them, or else you can give the child frequent sipping of water. Okay. And then there is one thing which I was always talking about, like fluoride. Fluoride, it is a common ingredient. Actually, as we all know that it's in our toothpaste, it's a common one, fluoride. And even to ensure the fluoridation in the community, the government is going through community water fluoridation, school water fluoridation, and so much of things in order to incorporate this element, fluorine, in the in our food and water, so that adequate supplementation will help us in a stronger teeth as well as bones. It is required for both. So in that way it is going, but still if you feel that there is a lack of fluoride or in the diet of the person, through with the help of your doctor or a dentist, you can supplement them with the help of kind of, there are so many available products in the market, like varnishes, there are gels available, and even there are fluoride containing toothpaste, as we already told. So these are all the things which we can topically supplement to help them grow better, to help them tackle these dental problems. And also, again and again, the lack of toothbrushing will be the first thing to cause this plaque accumulation or the dental food debris accumulation on the dental surfaces, and then lead to the formation of holes. So this is a process of tooth decay formation in just to brief, like the sugar or starch, if once interact with the microorganisms already present in the mouth or in the plaque, it will form acid. And what is this acid going to do? It is going to attack the enamel of your healthy tooth, and that is going to cause a tooth decay. This is the normal process in a brief. And the next thing which we have to give emphasis on is the food of our child. The food does not cause tooth decay as usual, and but the eating does, as we all know. And I have just mentioned what all kind of food habits can cause this kind of sticky sugary foods, and increasing the consumption in frequent intervals sugary foods. These all can be have a tremendous effect on causing dental caries. And the children's dental health depends less on what they eat and more on how they eat it. That is what we have to emphasize on. And the poor diet can even lead to maldeveloped teeth like this, wherein you can see here the enamel hypoplasia. This is a condition where they are having non-healthy enamel. The enamel of this teeth are not at all healthy. You can see there are colored surfaces of teeth and all. And this is the food pyramid which is being recommended for the children, for the kids and all. There are so many ICMR like organization, WHO like organization, which have come forth with their recommendations. But that's the not a new one. We all know we have to go for a generous amount of vegetables and fruits, and again we have to go for a generous amount of water supplementation. Whereas dairy or milk should be given in 2 servings, not too much. And even the proteins, which is the most building block, that the grow food which we talk about, the proteins which is rich in meat, fish, beans and all, they can be given in 2 servings. So what should be kept in minimal? The kept in minimal is what we think is, for adults it's always fats and oils and even sweets, but even for children it's the same. We think that might be it's my child, they require it, you just give them more and more of butter, more and more of ghee. No, not at all, it's not required. There is just an amount which is being required, like maybe if an adult requires just a teaspoonful of ghee one day, a child will require a 2 or 3, not more than. Giving them more than that might cause them more harm than good. So that's the kind of attitude we have to keep. Even it's a fat, oil, or sweet, it's not just they're growing and they need it more. It's just that they need it might be twice the quantity of yours, not more than that. That's all. So just go generous on the vegetables and fruits, because they are the foods which they're going to serve better, because they are the foods which are rich in vitamins and minerals, and along with the serving of cereals, which are usually we are aware of as in Indians. So these things are going to help them grow better and have a good skeletal as well as dental health. Now, coming to the fluoride exposure, as I have already told you, the fluoride exposure is already there as community and water fluoridation, but you can even regularly schedule the fluoride treatment, and also as well as professional prophylaxis are available, wherein you can approach your dentist and they can give a fluoride treatment for your child in the form of impressions, in the form of varnish, what we call it's kind of preparation, varnish, even gel form is there, they can apply that. And 5% neutral fluoride varnishes are the ones which we can apply at home. It is even available in the market. And American Dental Association have even accepted dentrifies. So that are the ones that I've already talked, Kidodent, Pediflor, and all of things are the dentrifiers or toothpaste. Dentrifies is actually a toothpaste wherein you have fluoride content in. And some clinicians treating children should know that special healthcare needs, these children who have the special healthcare needs, they have chronically poor oral hygiene and their decay rates might be more. So they suggest like 0.05% of sodium fluoride solution on an everyday basis, a rinse at home can do a good for them. Can decrease the dental cavity in them. And even night application of 0.4% stannous fluoride or 1.1% of sodium fluoride can also be good for preventing the occurrence of dental caries. Now, since going through all this kind of home dental care, what all things we can do, and what are the common dental problems which are encountered in this kind of children, I would just talk to you in a brief about a role of dentist in exercising dental care, what a dentist can do here. Sometimes so many parents are scared, or even they are like they feel like hesitant whether my dentist can understand what kind of things my child is going through, or maybe they are fearful of they are because of the concerns they are fearful. So that has to be addressed first actually. And you have to get familiarized with that special problems of the child. Even for the dentist, they have to get familiar with the special problems of the child. Only might not be able to do in the first visit or so. Even they are professionally trained, they have to go through the special healthcare needs, or it's all tailored, customized. Even one autistic child will be different from the other. So that time you should give for the third person, whoever it is, the dentist or a doctor, to understand and comprehend with. Then you can help them, you can cooperate with them, so that even we can give them a better oral health care. So first thing would be obviously to familiarize with them with the special problems. And then the dentists have to spend much time with the family, obviously, to know about the particular things which the child needs to, which is interested to do, or they might not be interested to do, what the child is afraid of or not, and etc etc. And also this is kind of a service wherein this kind of care, it extends beyond the chief complaint of the patient. It's just not the chief complaint which has been addressed to, we have come for a decay, okay, I will just give you the methods in which you can fill the decay, I'll fill it, and then you can go tata bye bye. That is not the care just we expect from a dentist when you go with a child with a special health care need. And most of them are aware of that. And then for that we need to cooperate with the dentist, and they know that there is a service which has to be extended beyond the normal one. And these are the kind of parents attitudes once they come to the dental care, to take a dental care. There's some kind of fearful, I've already told, like fearful parents, they're afraid that the child might get hurt. That is very well taken care of. Once you are taught about the procedure, and once you know what are they going to go through, then once you familiarize with the procedure, you can be a model to them. That is the way we do modeling. Okay, so kind of behavior shaping method. And again, there are certain overly protective parents. They might be ashamed of their child or totally aware of the problems. Might not be sometimes usually concerned, but they are actually ashamed to face the public or even the doctor. So it's not the way to do so. So just give them some time, or just give the doctor also some time, so that they will know the child on their own. They will take time and they will study it on their own, and just go through the process. Then you will understand that this oral delivering the oral health care is not just that much a tedious process. And there are sometimes ashamed parents, even they feel humiliated when they appear in the public with their child, if they're kept in the waiting area, in the reception area, etc. So for that also, the dentists are aware of all this kind of parents attitudes, and they can help you get through the problem easily. And why should a dentist use this behavior guidance? So, see, the behavior guidance should be used everywhere, even by a doctor, even by a dentist, everywhere, so that it becomes easier for them to exercise care. It is easy for them to establish communication in that way with the child, and they should alleviate the fear and anxiety the child is going through. And in that way, they can deliver a quality dental care, and it helps in building a trusting relationship, so that next time the child would like to visit the dentist once more. And also, it helps to promote a child's attitude, a positive attitude towards the oral health care, so that it helps him increase that positive reinforcement towards brushing to enhance the dental health care and all. So that is the one way. And what are the tips you can take that for a dental visit? First thing is to, if you haven't started visiting any dentist till now, start now. That is, the American Association of Pediatric Dentistry recommends that every child should establish this dental home visit by her first birthday. So earlier the visit, it would be better. And if you have not got a toddler who have not yet visited dentist, make sure that you identify a good dentist in your locality and get acquainted with him or her, and then you get in first appointment. It just not be a routine dental procedure is not needed, just to get acquaintance, just to get, you might have your own queries how to deal with the kind of eating habits of the child, or how to deal with some other practices which you are not which you are concerned about. For that purpose also, you can even meet a dentist. So that would be like a familiarizing up our child to a dentist. So the pediatric dentists have got a specialized training for this, though. So they will have this child friendly atmosphere also in their clinic. So you can select an appointment whenever your child is alert and rested. So as a parent, as we all know, the parent plays always, the caregiver plays a key role in the child's dental care. And the children often perceive a parent's anxiety as a awful one, because fearful experience the child will experience from the parent's face. The child will interpret that okay, this is, we are going to a tedious procedure, or we are going to do a troublesome one, it's going to hurt me. That kind of facial anxiety should not be exhibited by the parents. So for that purpose, you should be the one who should get acquainted first with the dentist and even the procedures. So they tolerate the procedures best when their parents understand, and they are prepared for that, you know. And if you have any questions about that appointment, about the kind of treatment they're going to go through, you can ask them. And once you become confident, so that your child will also become confident, and again you can do that kind of modeling, behavior shaping. Explain before the visit that the dentist is a friend, and he will help your child to keep his teeth healthy, and that will make the visit a fun. And answer all your child's questions. Just don't deny them or ignore them, thinking of, if they come to you with some kind of scary story from the peer or sibling, or ask you kind of, or give you some kind of gestures through your activities, just address it. And just be careful that you don't use any kind of scary words. Just how we say that once even we play with our child and all, what we say them, if you do that kind of activity, I'll take you to the hospital, I'll give you injection and all. So in that, if you talk to them like that, if you don't behave politely, I'm going to take you to the hospital and give injection, then that child's mind is registered in that way, oh, I'm going to get hurt. So that is kind of a scenario wherein you are giving them a negative attitude. You are developing one of, once the child visits a hospital itself, he will feel, oh my god, my mom has already told me that yeah, I'll get an injection, it's going to be painful. So that's a kind of you are imbibing into the child, that is not good. So you should not do anything to say that it's going to hurt them. So read your child a story about a character which they might like, some kind of like Peppa Pig or some Donald Duck or whatever it is, and they tell them that how good a dental visit they had, some kind of uh, I mean exaggeration or thing, fancy things which you can do, so that the child understands this dental office is nothing but just a kind of usual place where people go to. And make a list of your questions about your child's oral health in advance before you visit the dentist. And this could even include the topics like home care, injury, or even prevention, diet, snacking, fluoride, tooth development, etc., etc. and give your child some control over the dental visit. Or like even when the dentist asks it, give them choices. You see, like if you want to make them do something, you ask them, will you hold it, or should I do it on our own? Or even you can entertain them by asking questions like which color of the toothbrush you like, and what kind of things you want to, which color of toothpaste you are going to use, like that. So that would help them, they would help them to enhance their knowledge about what kind of things which I'm going to go through. And also they will, that will inculcate a good habit in them, so that they can do their dental care on their own. And give the center stage to the pediatric dentist. If the dentist does most of the talking, and that would help build a better relationship. The parent and the pediatric dentist can talk after the examination, once they have gone through all the talkings and all. So that is the thing, tips which I would like to give to all the parents who are having the child with special healthcare needs. And the next thing would be to familiarize the dental clinic for the children with special needs. What, how a dental clinic might appear like. That would be the best thing to do before taking them to a dental visit. So Diaco dental chair. Normally the dental chairs look like that, which you see on the first picture. You can see it on the right side. I've exhibited a dental chair with a normal one, whereas a one with which is helpful for wheelchair, wheeling in a chair. So that would some look like something like this. On the left side, you can see a Diaco dental chair for wheelchair users. Now, this is how it is. And you can explain the positioning, the slap positioning, as I've already talked to, and should be more convenient for the child. And show how you can do the technique or do the procedures, do the treatments in the child. There are so many ways of behavior shaping, as you all might be familiar with. Tell, show, do is the most famous and the most acquainted technique. So this is how we can do, ask them to hold it, whatever the dentist is going to do with them. You can ask them to feel it, feel for it, it's not hurting them. Just ask them whether they liked it or no, not. Maybe some, it might be some kind of water spray or something. Then try it in their mouth. Just by in the initial visit itself, if they're going to bring it to the child's mouth, and it is going to trigger a fear and anxiety in them. So most of the dentists don't do that. And even before going to the dentist, also you can just familiarize, the parents can familiarize to the child's, telling them that this see, this is kind of a syringe, you know, it sprays water into the mouth, it is not going to do any harm, it's like a shower and all. So that's kind of fancy things around. And even you can give them some kind of models, and you can ask them to do things and all. And you can do a positive reinforcement. You can give a praise or a reward, or maybe even a small token of love as a form of gift, a toy and all. So most of the pediatric dental offices do that in certain cases. And one more thing which you can do very well is by modeling. Maybe you can ask to perform the procedure in a cooperative child, and the child which you with the special healthcare need can watch it, the procedure by his own, on his own. And then he can understand that it's not going to do any harm to me. In that case, he will be very much cooperative in that case. So that we can do. Maybe even the mother can do the procedure on herself. He can The dentist can be asked like that. And then they can be a model to their child, so that the child will feel, okay, if it's not going to harm her, then it might not be harming me also. Kind of modeling thing which is going to work very good in dentistry. And even sometimes we need distraction kind of therapies in case of children who are having this kind of stoic behavior, so that their attention has to be focused away. So for those, you will need some kind of audio or video devices, audio visual distraction devices, so that their attention is deviated away, so that you can work on the oral cavity or mouth. And even voice control has its own action. Most of us, we know, as parents, we exercise this voice control, so that can be done in even a dentist visit. And sometimes desensitization, it works wonderful in case that you can gradually exposing them to a new stimuli or a new experience by increasing the intensity. So this is a dentist, you can see from the pictures, a dentist who is experiencing how it is going to work, the motor, which is she's going to place this motor into the oral cavity of the child, into the mouth of the child. She's going to cut the tooth, prepare the tooth before filling it. We have to prepare the tooth, remove all the germs, and then fill it with a substance or the therapeutic medication. So for that, beforehand, she's going showing her showing the child how it is going to work, how the water is going to come out and all. So this kind of desensitization technique, so that the child get desensitized with the vibration, with the noise, with the water spray and everything, and they feel comfortable once the procedure has been done. And while taking radiographs, when they are going to take x-rays, you can tell them that it's like a lollipop. You can give a lollipop to your child, you can ask the child to sip on it, and gradually you can use x-ray film, you can tie it on the lollipop, and then you can ask the child to hold it and lick the lollipop again and again. And after that a few licks, you can ask the child to hold the lollipop in his mouth, and you can tell them, see, I'm going to position a camera and I'm going to get a picture of that. That's all. So that is how you can make an x-ray examination in a child. It's so easy as that. So dentists are going to do it in that way. It's just to make you familiarize with the methods of the dentist. And then this is the kind of stabilization which they are going to do a child. Maybe the child is a little bit shy or a stoic child. Sometimes it might they might need to stabilize them. So with the help of protective stabilization, which is exerted by the parents, is how they can do. They can put their they can entangle the child's legs with the help of their own legs, and also they can put forth their arms on their chest, so that it helps them to stay calm, composed, okay, for the procedure to be done. And also it encourages relaxation, and it will prevent those undesired reflexes in the child. And before doing any protective stabilization, you don't have to worry. All the dentists will get an informed and consent from the parent, so that not be used as a punishment or according to the convenience of the staff. Obviously not. And these are the methods of immobilization which usually the dentist give you. Like this is mechanical aids for mouth opening, like tongue blade or a wide mouth prop, wherein if the child cannot open his mouth for a long time, maybe even some 5 or 10 minutes, they will find it very difficult. For normal people also, it is very difficult to stay our make our mouth wide open during the procedure. So for a normal child, it is even for a child with special healthcare need, will be very difficult. So in that case, we have many assisted devices like tongue blades and props to make their mouth open. And this is an example of that physical stabilization or physical restraint, like Papu's board, which helps them to hold while doing the procedure. And this is an example, a picture wherein use of Papu's board is being depicted. Okay, and next is wherein you can use a triangular sheet. Triangular sheet can be used like a simple our bed sheet, no, which we use at our home. We can just tie it as an economical method. You can ask them to sit upright and just to strap it to the patients with the help of on the chair to position him or her. And it is difficult in small patients, but still it can be exercised, and it's a very useful method. And there's something called as pedi wrap even, which is available with the dentist, which is called as rainbow stabilizing system. It has got a backboard also sometimes, and it allows a small movement, but still it confines the patient. These are the things which are useful for those who are having very difficult to care, or the children which we categorize as mentally retarded, severe mental retardation, or those with cerebral palsy and all. Not for all. So it's just to familiarize. It's not going to be used for all the children. It is for the children uh, who are very difficult to exercise the care on. And there is some called bean bag for children who are a little bit of shy and who show some kind of indifference to the treatment methods. They can sit comfortably, they can be accommodated on this kind of bean bag, and it fits most of the people, so they can relax, and the dentist can do the procedure. And these are kind of velcro straps or posi straps which fastens to the arms of the dental chair, and it allows limited movement, and it prevents the overaction by the resistant patients. And there are towel and adhesive tapes again for be used for athetoid or cerebral palsy patient. And head positioners might be there to help you position their heads over the chair and all. And even for those who are very uncooperative, we can go for anesthesia or sedation like nitrous oxide sedation, which are normally used, and they are not at all harmful. They are very harmless, that the procedure can be done, and the person can be dispatched on day-to-day basis. So once you come to the dentist to take the appointment, you are just appointed for a certain, maybe a tooth filling activity, or maybe a tooth extraction, what we call as removing a tooth. Okay, so for that, maybe it takes a few hours or maybe even a minute's time. That's all. So it can be done as an outpatient procedure, not that you have to admit your child and all. But the thing they have to take care of is there might be many numerous medical problems also for the child, for which they have certain contraindications of the procedure, or might be some drug interactions which might occur. That we don't you don't have to, even the parents don't have to be afraid of. Even all the dentists, normally the pediatric dentists, have got ample training in that, to how to anesthetize the child or sedate the child if they are very much incooperative with that. And all those other devices which I've already mentioned are found to be a failure in use. So in that case only we can go for an anesthesia or sedation. And even if certain parents insist on giving a sedation for their child in certain procedures, that is also fine. There is no harm in doing that. And what all ways a dentist can help you. So now we have familiarized how a dentist clinic will look like, and what all things a dentist might have to help them give treatment for this child with special healthcare need. And but also it is important to know where all you can get a treatment for, or what all treatments can be availed from a dentist for your child. So that is the thing which I'm going to brief on in the latter part. So the first thing would be the fluoridation. I've already talked about so much in dental decay and all, about the diet part and all. So that time I insisted on use of fluoride. So that I've already told you, there is fluoride mouth rinses which are available in the market, fluoride toothpaste which are available in the market. In spite of that, sometimes your child might require a fluoridation, a professional fluoridation that can be done with the help of a dentist. And then you have some kind of sealants or dental sealants, atraumatic restorative materials, we call them like that. Sealants, they call as pit and fissure sealants actually. That is just to protect the teeth from decaying. Once the teeth are into the oral cavity, they might have some pit and fissures, they might be discolored, and the child might go for a small sensitivity issue, not the pain, it might be a little bit sensitivity. Once the frank pain develops, we cannot just do a sealant on that. Once a frank pain develops, if the child is having some kind of swelling and all, that has to go for some kind of tooth removal might be done, or you can go have to go for a advanced procedure like root canal treatment and all. This is just a preventive method in the sense that the caries is not going to occur if you're going for this kind of there are deep pits and fissures in the oral cavity or the in the teeth surface of that child. The parent can insist on doing this kind of dental sealants, and the dentist can identify which all teeth need this kind of treatment, and they can give this kind of sealants so that it is not going to get decayed soon. And this might be one condition where so many are affected with yellowish teeth, or kind of there are some defects on the enamel of the teeth, so that it is very the aesthetic appearance is affected. So for that purpose you can very well undergo a procedure called as microabrasion. And these are all professional help. You have to take a professional help. You cannot do any home care on that. Now I'm just briefing on the dentist part of activities. And this is how it looks after bleaching. Bleaching is a kind of technique wherein you might have heard whitening of teeth and all. So that is how before and after it looks. You can see that removal of stains and all, it has been removed, and then that yellowish part looks very well normal white now after the procedure of bleaching. Now the next thing will be, you can use restorations for the whole or decayed teeth. That could be, sometimes there are black color restorations and all available nowadays. That is outdated. Most of the clinics not use that. Now there are white colored restorations, we call it as composite resin restorations, or even we call it as glass ionomer restorations. These restorations are available. You can just, it's layman's term, it's a white colored restoration. The dentist can choose which tooth is fractured. They can give you a range of products where you can go for which one to select, which one is having good strength. If it is a front teeth, it might not require to have more strength. But it's a back teeth which is hole, there is a hole in the back teeth, you might need a filling material which is more stronger. So that will depend upon the choice. Okay, so that the dentist can brief you on that kind of restorations which are available and all. It's just pictures I've put. And even if the tooth is very much decayed and it is very cumbersome, there's always food lodgement and all. Sometimes the teeth is very less in size because of this kind of clenching activity of the child and all, which we call as bruxism, the clenching activity. Because of that, the teeth size is getting small and small, because the teeth surfaces are getting abraded. It is because of the friction, the teeth surfaces are getting lost. And also because of the decay, the tooth surface has more more and more getting lost, so that the child is unable to chew with the teeth. In that case, you can cap the teeth. For that, you can use certain crowns. And most commonly, the least expensive would be stainless steel crowns. And even sometimes for aesthetic purposes, if it is in the front region, you can go for white colored crowns are there. So that can be used ceramic crowns. That are the ceramic crowns. These are stainless steel crowns I've shown you. These are tooth colored crowns. The front region, you can use the ceramic or porcelain, or you can call it as zirconia crowns. You can call it as composite veneer crowns and all. So these are the tooth colored crowns. There are so many range of products which can be used for the treatment. And even we have talked so much a lot about malocclusion or malalignment of teeth because of this lip smacking habit, lip trap habit, tongue thrusting habit, and even for mouth breathing and all, there might be so many malocclusions. So for that, we can very well go for this fixed orthodontic braces. This is called the orthodontic treatment. For that purpose, these treatments are all done by a pediatric dentist. You don't have to go for each and every department and knock on their doors. It's not needed. If the child is very well below the age of 15 years or say 13 years, the treatment can be very well obtained from a pediatric dentist. If he or she is beyond that 13 years, you can approach an orthodontist for this procedure, for the alignment of teeth. You want to get the teeth aligned so that it will be easier to maintain a dental care. It's very easy for it's not that easy to talk about an orthodontic treatment in a child who needs special dental health care need. A child with special health care need might not be able to maintain this appliance also. So it is quite difficult, but still there are so many modifications wherein you can go for with the help of an orthodontics in that case. So this just an before and after picture of an orthodontic treatment. That is how it works. It works magic. And it also helps to stabilize the jaw growth. I've already talked about the increased jaw size, decreased jaw size and all, no? So with the help of an orthodontist, even that part you can get corrected. This is the one which I've already talked, like decreased jaw size, increased jaw size and all. These are there are certain myofunctional appliances which an orthodontist might give to treat such conditions. Like say this is a face bow actually, and there are some kind of headgear things. It is difficult. The child might not comply with it. Maybe with training and lots and lots of patience, you can make them comply so that the aesthetic appearance of the child will not be affected. This is not for that severely retarded or severely differently abled child. It is usually useful for the self-care or the moderate group. And this is a prosthodontist who can work this wonder. If for a small child, you can very well approach a pediatric dentist if they're beyond the age of 13 years, and if they have this condition wherein you can see oligodontia, that means decrease in the number of teeth, you can go for fixed implantation of the teeth, fixed prosthesis. Normally, we don't prefer this removable prosthesis for the child with special healthcare needs. We usually go for only fixed ones. So for the fixed ones, you can even meet a prosthodontist in this concern. To conclude, this children with special healthcare needs may present actually so many challenges, and that requires a lots and lots of preparation for the dentist as well as the supporting staff, whoever it is, even for the caregivers and all. So, in addition to that, there might be most of them will be associated with a parental anxiety. That would be mostly concerning the problems associated with the child's needs, and that would sometimes delay the dental care they are going to get. In that way, what is the problem is that because of that delay in the dental care, that oral disease is going to get full-fledged, or it is going to get into a severe form. So that is very difficult to manage after that. So in that case, it is very early management is effective thing, or even prevention is always better than cure. And if for that, you have to familiarize the child, and even the parents of those children should be familiarized with the dental activities and with the dentist and all. And if a dentist also becomes familiar with the child needs of the child and also the parents concerned, the dental management of such children will be very much gratifying. So I hope this had given you some views, at least to take home certain points, might have helped you in some way, at least I hope so. And thank you for patiently listening to me. I hope this might have been helpful a little bit. And there are so many things to add upon to. Because of time constraint, we couldn't. And I would add upon, or I would request you to go through the references, if at all, if you want to read more onto that. There are so many things which are available online. So these are the references I've gone through. The treatment needs of children with disabilities have been addressed very well in so many articles online. Thank you so much, all.
Thank you, ma'am. We will have some questions in our comment
Sure,
box.
sure, 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 sure. Okay.
Ma'am, here is the first question is that some
Yes.
special children, even after reaching the age of 18 and above, still drooling.
Mm.
How can we stop this, ma'am?
Okay. See, that's a very good question. Actually, I can thoroughly understand that it is not just because of their habit. I had just mentioned you the drooling thing. It's just not because of the habit. There might be some reason behind this drooling. It could be due to the positioning of the tongue. It could be due to their malocclusion. It could be due to their increased adenoid hypertrophy. That's what we call, like increased enlarged swellings, or their decreased tongue space. There are so many reasons behind it. If we could address this problem, that would help the child from prevent the child from drooling. That is the one thing which we have to get a professional help for that. A pediatric dentist might help you, or even a pediatric surgeon might help you in that way.
Thank you, ma'am. And the next question is, how
Yes.
many times we have to brush our teeth for healthiness of teeth, and how can we manage teeth decay?
Okay, how can we manage teeth decay? Okay, see, actually there is normally, according to the protocol and all, according to the theory, what I could say beautifully is that normally we advocate brushing twice a day. Brushing twice a day with a peanut of peanut size of toothpaste. That is all what is required. Peanut size of toothpaste. Peanut is like groundnut, groundnut size of toothpaste is what's all required. If it's an infant or a baby, you require a rice, like a small grain. No, rice looks a small grain. That much amount of toothpaste. That is what is required for brushing your teeth. Normally, we advocate that, but still there is a correction which I feel to give you. Like it's even one brushing once is quite helpful. Just you brush once, but the brushing technique should be good, and you should ensure that the surface of the teeth are clean. And if you have gone through some product or some food which is actually had, you think that is going to stick to the teeth, even the child can't express it, or the child cannot tell you, see, this has been stuck into the mouth. Every child can't do that, obviously. So in that case, if you feel like I have fed him something that might stick on to his teeth, just give them a brief stroke. That's all, just with the brush and plain water. No need of using any dentifrice. Just make sure that the debris is not sticking into it. That is the only thing which is required for maintaining a proper oral hygiene, as well as to prevent decay of the teeth.
And the next one is, ma'am, what is the reason for bad smell in mouth and how to avoid it?
Obviously, that is the one thing which I have not addressed in this. Actually, bad smell in the mouth can be due to an n number of reasons. There are so many reasons which have been given for the bad breath, or halitosis. That is what we call in dentistry. So bad breath can be due to this. One important thing is that I've already talked: decayed teeth. That is, you are having a child is having a hole in their teeth, wherein there is food is getting trapped inside the hole. It's going to stay there for days and even months, and that is going to give a smell. That it is going to undergo some kind of putrefaction inside, so that is going to give a decayed smell, and that is the main reason. And the second one would be this food debris attaching to the difficult spaces wherein a toothbrush can't reach. That is why I have talked about that interdental cleaning aids, or the teeth spaces can be cleaned with the help of certain aids. I've already talked about it. So in that spaces, if food debris is getting impacted for a long time, you can get a bad breath. And another thing will be a dry mouth wherein saliva is less. The saliva is less means you have to go for a salivary substitute, because it is again acting as an antimicrobial. Saliva has got an antimicrobial property wherein which we don't have this kind of bad breath. Normal persons don't have the bad breath. So that is one thing. And again, the bad breath can be due to n number of problems, like patient is having uh, what we see, rhinitis or a blocked nose, so that they will have post nasal drip. That is what we call in our language. Post nasal drip means they will have this mucus which is secreted into their oropharynx or inside of their oral cavity, inside their mouth. And this kind of secretions are going to stay there for a long time. If the child is going to suffer with this drip of mucus, I hope you understand. Mucus from the nose to the mouth, it's going to create a smell in the oral cavity of the child. So that is another reason. And again, some kind of bacteria, if there is more and more number of, there are healthy bacteria in our mouth. I hope we all are aware of that. The healthy bacteria is good for us and it should stay there. But sometimes there might be some reasons, with some reasons, some children might have some kind of physical disabilities also, medically compromised, they might be in certain areas. So in those kinds of medically compromised children, or those children who are taking repeated drugs and all, what happens to that antimicrobial flora, the microbial flora in the oral cavity is getting altered. The kind of bacteria, good bacteria will die and the bad bacteria will survive or proliferate more. So in that case, what happens, they will have the issues of bad breath. That will lead to more and more production of acids in the oral cavity, which is going to give you a bad breath. And many more reasons are there. I've just given a few reasons. These things which we can address. And one more important thing for bad breath could be a lack of tongue hygiene. Obviously, even normal adults like us sometimes even forget to brush our tongue after we do our toothbrushing. So that cannot be forgotten. It's a very important step to keep in mind. Once we brush our teeth thoroughly, make sure that your tongue is cleaned either with the help of a tongue cleaner, or even you can use the tooth brushing surface, not the back. Don't have to use the back of the brush and all. Even the small bristles which are soft, use not we don't use usually hard bristled toothbrushes. We usually moderate or soft bristled toothbrush is good to clean the tongue. That is a very good way in which you can prevent bad breath. Even you can go for mouth rinse. If it is not helpful in all these ways, you can go for a mouth rinse, like which I've already explained. Hexadin and all are helpful in even controlling a bad breath to an extent. Can I have the next question?
The next question is, how long once we consult a dentist or dental hygiene?
How long is actually a normal person, I can tell you, a normal person can visit a dentist twice in a year for just cleaning his oral cavity or mouth. That is just to make sure that he's not attacked with any kind of dental decay, which we cannot see on our own, or we cannot clean the surfaces, which we cannot clean with the help of a toothbrush. For cleaning those surfaces, we can get a visit twice in an year. For those children with special healthcare needs, this will differ, obviously. There might be children who are not of the self-care group, or a partial care, moderately able children. There will be those totally restricted ones. Those will need special attention. So for that purpose, you might need to take them maybe some 3 or 4 times a year. So this varies. There could not be a particular protocol to say like this is the important thing to do, or this is how long, or how often you have to visit the dentist. You cannot say it in that way. Any more question?
Yes, ma'am. Another question is
Yes.
zirconia crown came out in MRI scan as it has mental particles?
Okay, that is again contradictory scenario. Zirconia crowns. Has it been asked from by some doctor or a dentist? I would like to know. That's why.
I don't know who it is, but her name is Lovely Gupta.
Acha, okay. Good to know. It's a good question. Actually, usually asked to maxillofacial radiologists like us. Actually, I would like to throw a light on this in a social platform like this. It would be helpful for them. The thing is, zirconia is usually not considered. I mean, it's not considered a problematic thing in case of MRI. but it depends on the site wherein the MRI is going to be done. If you have to get an imaging of a particular area wherein this is going to be a hindrance, or how much small a tumor you are going to depict, or how much small the pathology it is, and how much kind of resolution you might need, depending upon that, you might have to remove the zirconia crown. It's not mandatory that you remove the zirconia crown. It doesn't have any interaction, or it's not going to, like we say that the patient who is wearing a pacemaker cannot be put in an MRI, put onto an MRI. That is a different scenario. It's not the scenario with zirconia. Okay, so please make sure that even if it's a ceramic crown, if it's a zirconia crown, it is going to give you an artifact. That is for sure. The artifact will be there in the X-ray. It is going to be there, not in the X-ray, then the MRI image. It is going to be there, but whether it is going to affect your determination of the pathology or your diagnosis, that depends upon the doctor entirely. Depends upon the area you need to examine. So with the help of that, with the help of the knowledge of that, with the help of a oral diagnostician, like a person of oral medicine and radiology, you can very well determine whether to remove it or not. So it is a customizable answer, actually.
Thank you, ma'am. And another question is that can we clean mouth of 2-month baby with our fingers after every feed, or while bathing? Doing once a day will be okay.
Acha, okay. See, as I've already mentioned, during bath time, you have to exercise dental care, that is for sure. A 2-month old child you don't have to do, even before bathing also, we can ask them, train them to do this toothbrushing, infant toothbrushes I had shown you, which you can put it on the fingers and then you can put it in their mouth and tell them that this is a brush, how it looks like and all. That can be done during bath time, before bath time. That is a regular care. That is a regular care. And for a 2-year-old, after every feed, you don't have to ask them to go and brush your teeth, because that will be annoying for them, obviously. So that is what I've told you earlier, that if you feel like whatever you have taken today, or your child has taken today, you feel like it's going to stick to her teeth surfaces, or it is something stickier which the child has consumed, like say a caramel chocolate, which is going to stick to her teeth, then you can ask them for a rebrushing, or once again you can ask them to go for a brushing, not not the help of a toothpaste, maybe just to remove that debris from to get washed away from the teeth surface. That's all. Any other question?
Yes, ma'am. There is another question.
Yes.
Age limit for MIS alignment into proper alignment of teeth.
Okay, so for normal children, if I say, like there is actually no age limit. Actually, there is orthodontics, that is the branch of dentistry which concerned with the alignment of teeth. So the alignment of teeth can be done at any age. It depends on the problem of the child. If your child is having a maldeveloped jaw, or say if your child is having a small jaw or a large jaw and all, that should be addressed as early as possible, because then time you can tap the growth potential of the child. You can even tap the growth curve, and then you can ask it to grow in that way. You can comment the body to do it in that way. With the help of certain devices, you can make use of it in your own way. That growth can be made to your own use. That is how it is. You can modify the growth activity. That is what you do. But once the growth is stopped, growth spurt is stopped, maybe the child is an adult, like 18 years and all, that is not going to be possible. So in that case, you have to address it in a different manner. So it will very well depend upon the kind of trouble the child is facing. If it is only malaligned, sometimes the parent will come and say to us, like, it is just the crowding, the teeth is overlapping one on the other and all. Nothing else, my child doesn't have any other issues. But once they bring the child to us, we can see that actually the maxilla is lower. Maxilla means the upper jaw is smaller when compared to the lower jaw. See? So that is the thing. These are things which we require a professional help. We cannot assess it on their on the own. This is not to blame anyone, or we don't have to take that much risk. Maybe if delaying the treatment might not help sometimes. So just don't delay the dental care, which is well deserved by your child. So they deserve the treatment. So obviously, you can just take an appointment to a dentist and just ask them, see, this is the condition which my good child is going through, whether I need to treat it now or not. So a dentist will give you a perfect answer for this query, because it depends upon the varying number of conditions. It is just crowding can be due to n number of reasons. It could be due to their smaller jaws, and even it could be due to their bigger teeth. We don't know what the conditions the child is going through. So with the help of a professional help, we can come to know that what kind of condition it is, and the treatment will vary depending upon this.
And another question, ma'am.
Mhm.
What methods we can use to get rid of the black marks on the teeth? Can we give any supplements for him? He is of 3 years old.
Okay, see, the black marks on the teeth can be due to many stuff. Either it could be due to kind of bacteria which is already present in saliva, the overgrowth of the bacteria which we call as chromogenic bacteria. In that case, the chromogenic bacterial stains can't be taken away as such. You cannot just rub them and remove them. We have to you have to take your child to a dentist and clean them. Whereas in case sometimes it might be due to some kind of medication your child might be taking. So once you remove the black stains, after that, once you give the medication, you can give them a little bit of water in order to rinse it away from the oral cavity, so that by that way you can prevent it from occurring. Once it has come, you have to get a professional help. Okay, so by simply using some kind of toothpaste as advocated from the market and all, it won't help you. And coming to the supplement part, sorry, I just forgot. Giving any supplement for such kind of child, with best you have to assess whether the black mark is due to some kind of developmental anomaly of that teeth, or is it actually due to some kind of acquired anomaly. Acquired means it might be due to some kind of dietary deficiencies. For that, you have to give some kind of dietary supplements. As we already told, like dietary supplements, nutrition is very important for preventing the dental development artifacts. So for that, you have to go give them vitamin A drops, D drops. They might require some kind of B complex vitamins in that case. So this all depends upon the condition. Just for the marks on the teeth and all, I don't think the supplements has to be given. It depends upon what kind of marks they have, and whether their enamel is healthy or not. The calcium or phosphorus content or the calcium content is enough for the child, whatever intake he's having. So depending upon that, it might vary.
Participants, anyone have any doubts to ask? Ma'am, can we wind up the session, ma'am?
Sure.
Shubha ma'am. Hello.
Hello, yes.
Shubha ma'am. Hello.
Yes, Sarvana.
Ma'am, shall I post the feedback link, ma'am?
Yes, Sarvana, you can.
Okay.
Shall we wind up the session, ma'am? Divya, ma'am?
Sure, Indu.
Okay.
Yes.
Thank you. Okay, now it's time for vote of thanks. On behalf of Rehabstore, I take this opportunity to propose the vote of thanks for those who have directly or indirectly contributed to our webinar today. First of all, I would like to give a special thanks to our presenter, Dr. Divya, for giving such a wonderful webinar today. Thank you, ma'am. Thank you for you spending your valuable time to present such a wonderful topic. Thank you, ma'am, for giving information about different kind of brushes that can help many special cat children to brush properly. Thank.
Thank you, Indu. Thank you.
Next, I would like to thank all our participants for joining us today. And I would like to express my gratitude to our Audra Special School Principal, Mrs. Shubha, for organizing this webinar today. And I would like to give a special mention to our Rehabstore CEO, Mr. Ravi Shankar, for organizing webinar every week to help many special care children. And finally, I would like to thank our Rehabstore team and webinar team for their support. Thank you all. Dear participants, one announcement. We are not having any webinar next week due to Diwali, but we are having our next webinar during next week of Diwali. For the further information regarding our upcoming events, please visit our website for the information, registration form and feedback form, etc. And participants, please complete the feedback form, which will be given in the comment box to get your e-certificate. Thank you all.
Thank you, Divya ma'am.
Thank you. I would like to thank the participants, and also I would like to apologize for prolonging the event. Actually, I haven't gone through the time. Just now I saw that I prolonged it for again 45 minutes more. So I hope you had some messages to carry forth from this topic anyway. And for that, I apologize to the team.
Ma'am, no need to apologize all, ma'am, because the session was really so informative. From the starting to the ending, you have clearly explained this with all the pictures and how we can handle the children and what are the things we expect from the dentist. You have seen it clearly. So there is no doubt in boring of the session or something like that. Really, the session was so useful, ma'am.
Okay, thank you, Shubha.
Da-
Thank you for the
Dr.
opportunity.
Divya ma'am, this is very excellent. I am speaking from Telangana, a
Okay,
special
thank you, sir.
educator.
Yeah.
You don't say it is a prolonged. You are given the right information for everybody, parent and a special educator.
Okay, thank you, sir. Thank you
Thank
so
you very
much.
much.
Thank you.
I think you can leave the session.